On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Robert Shapiro. Dr. Shapiro is board certified in nuclear cardiology, interventional cardiology, and cardiovascular diseases. He received his medical degree from Medical University of South Carolina and then completed internal medicine residency at the University of Virginia and a fellowship in cardiovascular diseases at Washington University Barnes-Jewish Hospital. Prior to joining Boulder Heart earlier this year, he was an interventional cardiologist at UC Health in Longmont and McFarland Clinic in Ames, Iowa. Dr. Shapiro sees patients at Boulder Heart at Erie Medical Center in Erie. Welcome, Dr. Shapiro.
Well, thank you for that introduction. It's really a pleasure to be here today speaking to the Boulder community, the community of Boulder here, and I'm excited to talk about the cardiovascular system at altitude. So I think that my slides will come up soon. And just in the interim, I'm very excited to be a part of Boulder Heart, and I've really enjoyed seeing the patients in the Boulder community and the wider Longmont community over the past several years. So I think we'll get started now. So I think what we should start with is talking about what specifically qualifies as high altitude. So there are different metrics that certain researchers have used to kind of quantify what is a high altitude, what is a very high altitude, and so some of these researchers talk about low, moderate, high, and extreme altitude. So where we are in Boulder or in the surrounding community would kind of qualify in this low altitude, or another kind of quantification scheme calls that high altitude, and then goes up from there. But the places that we frequently experience in Colorado, in the Front Range and then up into the mountains, are generally in the low altitude to the moderate altitude. And then if we're talking about climbing 14ers and things like that, we get into the higher altitude levels. And then the extreme altitude, we're kind of really talking about traveling to other places, looking at the Himalayas or the high altitude mountains of South America, those types of places. And so I won't focus as much on that in my talk today, but rather we'll focus mainly on the changes at our kind of base altitude here in Boulder and the community, and then also talking about the changes that we see as people go up to the higher altitudes when they go up to Rocky Mountain National Park to visit, or if they go up to Summit County or one of the other counties to go skiing or visit friends or family. And as we look at this globally, there are about 400 million people that reside above 5,000 feet. So it's not a small number of people globally. And so some of the data that we see on high altitude really comes from the fact that we do have a substantial number of people who live at higher altitudes. So the main concern with regards to altitude is the fact that oxygen levels are lower as we go up in altitude. And so with regards to the cardiovascular system, there are multiple different effects that low oxygen levels cause. And so what we see is that there are multiple compensatory mechanisms to try to help deal with lower oxygen. So as we look at this figure, we see that kind of starting in the middle, we see that acute hypoxia means that oxygen levels are acutely lower. And if we move up from there, peripheral chemoreceptors are actually receptors within our blood vessels that get activated by actual low oxygen levels. And so if we move right there, that forces our body to try to increase its respiratory rate. So we increase ventilation to try to compensate and bring in more oxygen. And as a response to that, our acid-base status changes. And so we see that we become alkalotic because we're losing CO2 as we blow off more CO2 because we're breathing quicker. And one of the responses that can cause is that it actually can raise the blood pressure in the lungs. So we see that pulmonary hypertension as a response. And in the bottom corner, we see that actually because of the low oxygen levels, the blood vessels within the lungs constrict. And that also contributes to increasing the blood pressure inside the lungs. On the opposite side, on the left bottom, we see that actually the systemic arteries, they get bigger. So they dilate up so that we can supply more oxygen to our vital organs and also to muscles and throughout the body. And as a result, things like heart rate go up, blood pressure goes up, and cardiac output also goes up. So the cardiac output is the amount of blood that is pumped over a minute's time by the heart. And so the additional thing that we see is that the sympathetic nervous system, which is our body's fight or flight response, is activated by things like just the low oxygen levels, but also additional things that we frequently encounter, so cold temperature, exertion at higher altitudes. And so all of these kind of are a complex interplay that affect our cardiovascular system. And we'll talk more about the specifics as we move forward in this talk. So what we need to talk about as kind of a starting point is also the idea of what are the acute effects and what are the chronic effects of low oxygen level. So when we're talking about acute, we're talking about really minutes to hours, these changes that can happen very quickly. And then chronically, as our body starts to compensate over days to weeks, we see different changes. So initially what we see when we look at these curves is that blood pressure drops initially, but then may trend up over time as these other systems come to play, like the sympathetic nervous system. And then similarly, heart rate increases initially, so it goes up, but then kind of slows down over time as our body gets used to the environment. And and then when we talk about cardiac output or the amount of flow by the heart, that again initially increases, but then can drop over time. And so as you see in the curves, in a graphic representation on the top part, so, blood pressure and peripheral resistance, which would be related to blood pressure, kind of dropping to start with and then going up over time. And then in the second, cardiac output going up briefly and then coming back down over time. And then talking about heart rate going up in the bottom line and then coming down over time. So, the importance is that people are going to have a different response if they just if they come up, from sea level to Boulder County or the areas around here, or versus the people who have been here a long time, or their bodies are going to have compensated and they're going to have different effects. But that being said, those who live here can still have these types of changes as they go to higher altitude. So, if you if you drive up to the park or up to ski or those types of things, we can see those changes even in people who are well compensated because they've been here a long time. So I would like to talk about some of the benefits of living at higher altitude. So, the challenge becomes that we don't have a ton of randomized data because it's hard to randomize people to living in certain places, at lower or higher elevation. So what we have is a lot of epidemiologic data. And so some of the research that was done actually looked at comparing different counties and comparing counties that were at a higher elevation. So, greater than 5,000 feet versus those within 100 feet of sea level. And when we looked at that type of data, we did see that there was lower mortality, so lower risk of dying from things like cardiovascular disease, stroke, certain types of cancers, especially colon and lung cancer, and also a lower mortality from Alzheimer's disease. Additionally, in men, there was a trend towards a 16% reduction in the rate of diabetes. And then when they looked at life expectancy, so for men, the comparison was that the life expectancy was about 1.2 to 3.6 years higher at the higher altitude counties versus the sea level counties. And then for women, it was a little bit lower because women live longer to start with, but about a half a year to 2.5 years. Now, the challenge with this type of data is that when you start trying to account for other things, so if you try to exclude smoking, lung disease, some of this difference in life expectancy may be attenuated. And the other side of it is that there may be other socioeconomic factors or lifestyle behaviors that are really kind of driving these trends. And that's always the challenge with this type of observational data, is that there can be other factors that we really can't account for, and that the altitude may not be the actual reason for the difference. But that being said, there is some data, and so I think that's at least the trend is towards it looking like it's better to live at high altitude for these reasons. Specifically, when we look at things like heart attack, the data would suggest that that mortality from ischemic heart disease was about 4 to 14 per 10,000 people lower when we compared people who resided above 1,000 meters versus those living within 100 meters of sea level. And we'll talk about some of the reasons why that might be the case here in the coming slides. Additionally, what we see is that there's data to suggest 20% lower mortality for people who can exercise to a certain metabolic equivalent. So one of the ways that we quantify your exercise capacity when we put people on a treadmill stress test is that we calculate the metabolic equivalents. And so those who can do at least 5 to 7 metabolic equivalents versus those who can't achieve, even 5 metabolic equivalents, have a 20% lower risk of mortality. So that's a big deal. And, one of the thoughts is that when we live at higher elevation, just doing, minimal activities, so things like slowly walking uphill takes about 5 to 7 metabolic equivalents. So the point here is that even just walking for exercise can be enough when you live in this area to really improve your risk of mortality. And so I think that's a very good thing to think about. We're not talking about having to do very high levels of exertion, but rather to be focused about routinely exercising at least to a moderate level for people. And so one of the complicated ways in which living in a lower oxygen environment can affect risk of diseases and mortality is the idea that there may be some sort of cardioprotective genes that are expressed based on having lower atmospheric pressure and then lower oxygen levels. And so obviously this is a very complex diagram, and I'll kind of briefly hit the high points, and then we'll focus on some of the specifics within the diagram in the coming slides. But I think that the key things is that with lower oxygen levels, there are certain genes which may be expressed. And so there's the HIF genes that are expressed, and those can result in activation of certain other genes within the cell that can lead to things like angiogenesis, which means the kind of growth of other blood vessels, can inhibit inflammation through the nitric oxide pathway, can stimulate erythropoietin, which helps increase the number of red blood cells, can affect the endothelin pathway, which can inhibit things like apoptosis, which is programmed cell death. And so we see that this complex interplay between lower oxygen levels, reperfusion, and reactive oxygen species. And so what we see is that that there may be very beneficial ways in which cells change under this kind of oxygen stress, and so that they may be better compensated to deal with other stressors, and then we may be less likely to develop disease based on this. So we'll talk some more about some of the specifics. So generally speaking, what we're talking about is that when the barometric pressure is lower, and then the partial pressure of oxygen, so then the oxygen, the amount of oxygen that your body is seeing is lower, these genes start becoming expressed. The other thing that we see at the higher elevation is that there's increased ultraviolet and ionizing radiation. And so part of the benefit could be related to synthesis of vitamin D. So when we look at patients or people who have low synthesis of vitamin D, they can have increased clot formation and higher parathyroid hormones, which can lead to insulin resistance. So, at the converse of that, so if we improve our synthesis of vitamin D, we may be less likely to form blood clots. We may be less likely to have insulin resistance. This may be part of the reason why we see kind of a lower risk of diabetes in men. And so this may help affect rates of diabetes, rates of high blood pressure, rates of just general inflammation in the body, all of which would be beneficial over time to increase length of life and decrease morbidity and mortality from those types of diseases. Specifically about the hypoxia-inducible factor 1 pathway, this pathway may specifically help reduce cardiovascular mortality because it is a key regulator of actually multiple systems. So when you're in a low oxygen environment, this pathway actually helps upregulate the formation of new red blood cells, because our red blood cells are the portion of our blood that's carrying a fair amount of oxygen. And so to help compensate for the fact that we're seeing less oxygen in the environment, our body compensates by increasing red blood cells. Additionally, what we see up in the top right corner is the idea of angiogenesis. So again, being in a kind of a lower oxygen environment, our body tries to compensate by improving blood flow to our organs and other tissues. And so by expressing these types of genes, we see, if we compare the amount of blood vessels on the left portion of that diagram A versus the right portion, we see a drastic increase in the number of blood vessels. And so the benefit may be that when we actually stress our body with things like acute insults, so if we talk about acutely blocking up blood flow from a heart attack specifically, then if your body has already compensated by creating more channels, then you may be less likely to have as much damage or more morbidity or more mortality from such an event. And then finally, this pathway of apoptosis, which is as programmed cell death, which helps the body get rid of sick cells, that again may be beneficial with regards to reducing the risk of certain diseases. And overall, this HIF1 pathway may also increase the metabolism rate, and we see that frequently, increased metabolism does help reduce things like diabetes and improve people's overall health. And so one of the ways in which our body, this kind of adapted body state, can be exceedingly beneficial is in the idea of intermittent hypoxic stress. So what we see is that because of the lower oxygen and the body's creating more vascular channels and producing more nitric oxide, which helps increase dilatation of blood vessels, which helps improve blood flow, there's a preconditioning effect whereby if someone has an acute blockage of an artery, so for instance, if they block an artery into the neck and have a stroke, or if they block an artery in the heart muscle and then they're having a heart attack, that they may actually be less likely to have as much damage. And so we specifically see this when we talk about, when we talk about heart attacks, we not infrequently see that patients who are older and have had long-standing disease, their heart is conditioned to a lower oxygen state. And so when they come in with a heart attack, they may be a lot less sick than a young patient who has not had any disease for a long-standing period of time. And if they acutely block up an artery, then they become much sicker than some of our older patients. And so it's kind of a corollary idea to say that that just the preconditioning related to living at higher altitude may be protective from this perspective of, your cardiovascular system, your neurovascular system, and also, peripheral arterial system and, perfusion to your limbs and other organs. Now, unfortunately, it can't all be good with regards to living at higher altitude. So unfortunately, there's certain things where we do see a higher mortality. And I won't get into this too much because it's a little bit out of my area of expertise, but specifically, we do see higher mortality from things like chronic lung disease, like chronic obstructive pulmonary disease or emphysema, and also sometimes with lower respiratory infections. And then when we talk about specific diseases, again, it may be protective to some extent from developing the disease, but if you actually develop the disease and then it starts progressing, you may have some increased risk of mortality as things get worse. And specifically with chronic lung disease, we do see that that living at higher altitude with lower oxygen levels can exacerbate just having low oxygen levels throughout the body. So when we measure, a pulse ox, it may be, chronically lower, and then that can lead to compensatory mechanisms that raise the blood pressure in the lungs, and that there can be lots of detrimental effects with regards to having high blood pressure in the lungs, unfortunately. When we talk about slightly higher elevations, generally above 3,000 meters, there is the risk of what's called chronic mountain sickness. And so what happens is that the body's ventilatory rate changes over time, and it starts slowing down. And so as a result, we start seeing that people have lower oxygen levels. Again, their red blood cell counts continue to climb to try to compensate for the ability to carry oxygen to tissues throughout the body. And then that can result in significantly high blood pressure in the lungs, and at some point can actually lead to congestive heart failure. So that chronically can be a problem for certain patients. But generally speaking, this would be at higher elevations than what we routinely see, in the Boulder community. And then the other thing is that sometimes we do see higher rates of heart rhythm issues, and I'll talk a little bit about that in just a minute. So I want to switch gears just a little bit and talk about the idea of thinking about if people are going to have friends or family who come to visit at the altitude of Boulder or Denver, or going up into the higher elevations in the mountains. And then also, I think that it's also a reasonable thing to consider for people who live here, who again are going to try to travel to higher elevations, and really thinking about where you're going to go, what the altitude of the trip is going to be, how intense of exertion you're planning to do. Considering things like hydration, alcohol use, drug use, and then trying to plan for, the worst case scenario. If some kind of event happens, what are we going to do to try to get people out safely? And specifically, I think that trying to acclimate for a reasonable amount of time before heavy exertion at higher altitude is really important. And there are some specific disease-specific states that I'd like to talk about. As a cardiologist, we'd like to talk about coronary artery disease. So those who have established coronary disease, unfortunately, the lower oxygen levels as you go up in elevation can lead to increasing symptoms because the amount of oxygen to the tissue may not be sufficient to prevent symptoms. So, one of the things to think about is, are symptoms controlled at either sea level if it's a visitor, or at at home if you live in this area before you go to higher elevation. And really, I think it's important to make sure that your symptoms are already controlled before you start stressing the body by moving up higher. And then the idea of recent events. So if you've had a recent heart attack, really delaying those types of trips would be important. And we'll talk about some of the recommendations with regards to that. With regards to hypertension or high blood pressure, again, acutely blood pressure can go up with altitude exposure. It may acutely drop temporarily, but then go up, kind of rebound past that. So I think making certain that people's blood pressure is controlled at their baseline, and then adjustments sometimes have to be made when people go to higher elevation. With regards to heart rhythm issues, again, like I said, going to higher elevation or having lower oxygen levels can trigger some arrhythmias or make them worse. And there is data to suggest that, people who are at risk for dangerous heart rhythms do have an increased risk of sudden death within the first 24 hours of going to high elevation. So, people who have a defibrillator, I think it's important to make sure that that's functioning appropriately, again, before we consider the idea of moving to higher elevation. Heart failure specifically, again, those symptoms may get worse with altitude as the blood pressure in the lungs may go up, and the medications may work differently as we move to different altitudes. And so being ready for that type of change and coming up with a good plan for patients who are struggling with heart failure. And then finally, with regards to pulmonary disease, again, the blood pressure in the lungs can go up, so that can be an issue. And when we look at nighttime oxygen and central sleep apnea, those types of things again may get worse at higher elevation. So we do see decompensation from certain people related to sleep apnea and low oxygen levels at night. So some people may require additional supplementation of oxygen at night. So to talk more about trying to acclimate to higher elevation, this is really just talking about letting your body spend time at a specific elevation so that it gets used to it, and it helps improve your ventilation, so your lungs are working more efficiently. You oxygenate better, so you use the less oxygen more efficiently, and then you improve blood flow to the brain to help minimize the risk of detrimental effects from moving to higher elevation. Ideally speaking, that would be probably 5 days before strenuous exertion. But there is data to say that even 1 day of relaxing and acclimating can result in a 6-fold decrease in the risk of sudden cardiac death in the mountains. So I think it's real important as you bring friends and family, or as you think about moving to high altitude to do activities, that you spend some time allowing your body to get used to the environment. One of the things to monitor with changing, and again, it's not specifically a cardiovascular system issue per se, but acute mountain sickness is definitely one thing that people can struggle with, and we see that it does increase in risk with increased age. There may be some increased risk of very young, but as a non-pediatrician, I'm going to stay out of that topic. But things to watch out for: symptoms like nausea, loss of appetite, vomiting, dizziness, fatigue. And those things may slowly get better. They may be mild, and if you take your time and acclimate, your body may get used to it. But it can progress to a life-threatening illness in rare cases, and sometimes requires medication. So when we talk about medications, there's a certain diuretic, which is called acetazolamide. And some people are given that by their their physician before they go to higher elevation to help minimize symptoms or to treat those symptoms if they end up having them. And so, just looking at this pathway, basically what happens, again, the low oxygen levels cause the oxygen levels in the blood to be lower. And so because of that, your body responds, it increases your respiratory rate. And because of that, again, you become alkalotic. So you're blowing off CO2, so your acid-base status changes. And then that kind of then changes your ventilation, and it can lead to these types of symptoms of acute mountain sickness. And acetazolamide tries to create actually an acidosis. So it actually tries to help change the acid-base status and reduce those types of symptoms. And it has been shown to be beneficial for people. So, for people at risk, I think talking to their providers is important to see if this would be something that would be appropriate. And then at the kind of the bad end of the spectrum is actually high altitude pulmonary edema. So that means actually having fluid go on the lungs from being at higher altitude. So when we look at the pictures on the bottom, the left picture is kind of at low altitude. We see that the lung tissue is kind of darker in this X-ray, and then when you look at the right side of picture at higher altitude, you see it's kind of a more gray or a lighter color, suggesting that there's actually fluid in the lungs. This can happen usually within about 4 days of travel. It can have a rapid onset. People will feel short of breath, they can be fatigued, they can have coughing, the oxygen levels, if they check, will be low. And really, the treatment for this is coming back down to lower elevation and then supplementing with oxygen. Again, medications, maybe acetazolamide, maybe other diuretic medications may be necessary to treat this, and really avoiding activity so that you don't create some kind of additional problems to your body. Because you're going to have less oxygen to supply tissues in the body. But untreated, this can carry up to 50% mortality. So definitely, if those types of symptoms are showing themselves, taking this seriously and seeking medical attention is really important. So with regards to guidelines for traveling to higher elevation, the Europeans have pretty good guidelines that they've created. The American College of Cardiology hasn't specifically put out a specific guideline recommendation. But when we talk about hypertension, again, this may worsen at higher altitude, and a couple of reasons. Well, at least one reason is that the fight or flight response, like we talked about before, may be increased, and so as such, that would raise the blood pressure. But one thing we also see is that the types of symptoms when you change positions, so feeling lightheaded or dizzy when people change positions, may also get worse, and especially people who are on medications for blood pressure as they go to higher elevation. And then specifically some medications, the ones that target the renin, angiotensin, aldosterone system, which are frequently used for blood pressure control, may be less effective as people change altitude. And actually the beta blocker medications may be more effective, so they could have an increased effect, and sometimes can that can be detrimental if there's an over effect. So, I think that the key things here are coming up with a good plan if you're going to make big changes in altitude with your providers, and try to figure out, what we think would be a best strategy if blood pressure may be an issue and may change substantially based on those types of changes in altitude. I won't go through the whole chart here, but I think that the major takeaways from this chart are, if you have really bad uncontrolled blood pressure, you probably shouldn't be going up to higher altitude. If it's under reasonable control, you should be able to do that safely. And if it's kind of in between, we may need to tweak your medication. So seeing your providers and figuring out the right amounts of your medications. And again, certain medications like things like acetazolamide may be beneficial as a supplement at a high elevation, and then adjusting different beta blockers may be better as people go to higher elevation as well. So again, I would just have people kind of speak with their providers if they're concerned about these types of issues. When we talk about atrial fibrillation or other heart rhythm issues, as I said before, heart rhythm issues can worsen at higher elevation. And one of the reasons is that heart rate just increases with altitude and with increased sympathetic tone. And so if you have, if you already have a diagnosis of a heart rhythm issue, even if it's well controlled, you may require more medications, or you may have situations where it becomes less well controlled with moving to higher elevation. And so some people who, their rhythm is resolved may actually have recurrence of the heart rhythm issue at high elevation. And so sometimes we do see patients who, came from sea level and they're doing great, and then they go up to the mountains and then suddenly they're out of rhythm again, and so they have to come back down and be managed. So it's definitely something to keep an eye on, and then clearly your body is the best judge of symptoms. So if you're having those types of symptoms, take that seriously, because we don't want to cause more harm if things are uncontrolled for long periods of time. For a coronary disease specifically, again, like I spoke about before, patients with heart artery disease can have symptoms at lower levels of exertion due to lower oxygen levels. There's some data to suggest that, some patients may benefit from like a submaximal stress test at low elevation prior to really trying to go to exert at high elevation. Probably if people are like really thinking about extreme, moves. So, if you're coming from sea level and you're going to go climb a 14er that's really strenuous, maybe talking to your doctor beforehand to see if that's appropriate for you, to try to help make sure that there's not additional medical therapy that would be beneficial prior to those types of activities. And I'll show you a little bit of data, but there is a risk of sudden cardiac death at higher altitude. So what we would recommend is that, people who have had a recent heart attack or other coronary event, they really should not be traveling to high altitude shortly thereafter. They should be letting their body recover first, talking to their providers before they jump up there, because there is some risk, and we don't want people to have bad events. So there was a study done. It wasn't randomized, but what they did was there was a Dutch study where patients actually had included, they had had a heart attack, and they were 6 months after they had had their heart attack and had a stent placement. And then they were compared with healthy subjects, and they had a stress test at sea level, and then they actually moved them up to 4,200 meters, so high elevation. And both groups of patients had a decrease in exercise capacity and the max heart rate at high elevation. So this is normal physiology, is that, you're not going to be able to do as much at high elevation. But, the short of it was that this type of study did suggest that even those who had had a, relatively recent heart attack could safely exercise, could tolerate exercise at high altitude. So I think, this, again, we don't have a lot of these types of scientific studies. Most of it's observational data, but I think this is an interesting one to point out. But the flip side of that is that, some of the adaptations to higher altitude can increase the risk of heart attack. So what we see is that patients who already have some cholesterol in their arteries, they can have what we call paradoxical vasoconstriction, which means that whereas a normal artery would get larger in that low oxygen environment, their arteries actually get smaller. And so that actually reduces blood flow to the heart muscle, and that can be dangerous. And like I talked about before, low oxygen increases the concentration of red blood cells, but there may be a threshold at which the blood becomes more likely to clot up. So increased oxygen, red blood cells may be beneficial for athletes who train up here and then go down and are Olympic athletes. And, that's kind of that blood doping idea. But though, if you're a patient who is at risk for a heart attack, this may actually be detrimental. And additionally, we see that there may be some increased risk of platelet activation within lower oxygen environments. And so, just as an example, Conrad Anker is a world famous mountaineer, and generally speaking, exercising at super high levels at very high elevations, and unfortunately, one day on a mountain in Nepal, he started having chest pain and had to be flown off the mountain and was having an acute heart attack and got a stent. So, I think that, we should be careful because these types of environments can be harsh on the body, and even these types of elite athletes can suffer these types of events. So, and this is just briefly showing some pictures and with the idea of paradoxic vasoconstriction. So on the top level, so the left side is room air and the right side is lower oxygen. And so the top are normal arteries, and you see that on the right top that the artery coming down in the picture, which is the circumflex, is actually bigger in the lower oxygen level. And then for diseased arteries, a little bit hard to see in this projection, maybe for some, but actually the artery has clamped down even more. So you see there's blockage in that artery coming down in the picture, and it's actually worse on the right. And so that's a detrimental effect. So specifically, I would keep an eye on older unfit men. So if you have friends or family who are coming from sea level and they fit in this category, keep an eye out because they're at risk, usually within the first few days of altitude. And then just to keep in mind the idea, if you're far from medical care, people can have very poor outcomes. So if you're not able to get to an advanced hospital to be taken care of by a cardiologist and specialists, that can be life-threatening. This graph just shows the risk. The black boxes are men. The white boxes, which are very teeny at the bottom, are women. So the risk of sudden cardiac death is very low for women, and these are age groups. But you see, as the age groups go up, then the risk increases substantially and exponentially for men. And I think in the interest of time, I'll skip over some of the guidelines here. But basically, you can look at these on your own. But some of the guidelines are that, if people have had a recent event, they should wait some time. And if they are having terrible symptoms, they probably should not go to high elevation. And if they're doing well and their symptoms are well controlled, they probably can safely go up to higher elevation under the care of their providers. And a little bit about heart failure. Again, these things like elevated heart rate, blood pressure, increased lung fluid content, and then decreased heart function can be problematic. And so, and the medications may also inhibit your ability to compensate for changes with altitude. So I think really if you suffer from heart failure, really talking to your providers before you make drastic changes in altitude would be beneficial. And I will leave this just in the interest of time because I want to get to questions here shortly. So I'll skip that. So just to sum it up, I would say living at altitude can be quite beneficial to your cardiovascular health, but some of that may be the things that you already do. So exercising, controlling your weight, it may be other factors that really are not the altitude. So keep those up. Take care when you have visitors. Make sure those with pre-existing conditions are keeping a close eye out for new symptoms. Stay well hydrated, avoid excess alcohol at high altitude, and plan on time to acclimate. And then, like I said, really your body is your best judge of whether you're having issues. So if you or friends or family have new symptoms, really have a plan in place to seek care if people are feeling worse, because we don't want people to get so bad that they're in a life-threatening environment. And so with that, I would be happy to take questions.
Thank you, Dr. Shapiro. That was very interesting. And we want to make sure that we let our audience know that at this time you can ask your questions, and we'll get to as many as we can. So these are in no particular order. Can you comment on altitude and long COVID?
That's a good question. I do not know the specific data. I think that part of it is probably that we're still trying to tease out the specifics of of long COVID and how environmental things or pre-existing conditions may contribute to those types of symptoms. With any disease which can have a specific lung effect. I mean, I think that the challenge that we've seen with other lung diseases, so lung infections or chronic lung disease, is that generally speaking, people may have worsening of those types of disease in the lower oxygen level. So, but I don't want to hazard a guess, but I would say that probably, there may be some level of the kind of lower oxygen levels at baseline may affect it, but I don't know the specifics.
Okay. Is there an altitude impact on pulmonary hypertension?
Yes, yes, absolutely. So I think that, as, several of my slides kind of talked about, pulmonary hypertension or increased blood pressure in the lungs. And definitely, the lower oxygen levels can drive worsening of pulmonary hypertension or it can raise the blood pressure in the lungs. And then the other things that can happen are that, having low oxygen levels at night or having worsening sleep apnea at higher elevation can also worsen pulmonary hypertension. So it definitely can. Yeah.
Okay. Specifically, are there any precautions that a person who has had bypass surgery should take when riding a bicycle up and down a mountain pass like Loveland or Vail?
I mean, I think that it's hard to generalize. So I think that in some respects it depends on the specific individual. But what I recommend of my patients is that if they have specific questions, first that they bring it up with me or they bring it up with their cardiologist to get our opinion on their specific case. But generally speaking, for most patients who have had a bypass surgery and they've healed up from it and they're doing very well, they can go back to high levels of exertion and safely do that. So I think that completing things like cardiac rehab after bypass surgery and then continuing to gradually increase exertional activity is an important part of the healing process. But that being said, I think keeping an eye on symptoms, so taking care to see if one's body is telling them that some level of exertion at some location is too much, and not trying to push through pain, I think is a very important thing for our heart patients, because we don't want them to put themselves at risk. And so, trying to take care. And then if there are questions, that's what we're here for. So we're happy to answer those questions on an individual basis for our patients.
Okay. Can you please define metabolic equivalent?
Yeah, so a metabolic equivalent, I haven't, it's been a while since I've thought about the specific definition, but it is a way of quantifying a level of exertion. And so it's a specific, level of exertion that we see. And so one of the ways that what we have is, there on our specific stress testing. So if we do treadmill testing or if we do other specific stress testing like bicycle stress testing or hand crank stress testing. We have specific levels that, depending on how long people go on these types of protocols, we can define the amount of exertion that they're doing. So again, it's been a long time since I thought about the specifics of but I would say what it is that it's defining a level of exertion so that we can compare what an individual's level of exertion is compared to other individuals, and then we have a sense of like what their exertional tolerance is.
Okay. Are people with too many platelets, essential thrombocythemia, at greater risk of clotting at high altitude because platelets are stickier? This person misses climbing their 14ers.
I think there is probably some increased risk. Yeah, I think that would be a concern. Is that that if you have very high platelet, high platelet counts, then there would be a risk. I think if people have specific questions, they could talk to their hematologist about that specifically. But as a generalization, I would say that there's probably some increased risk.
Okay. So kind of a flip question. Generally, how long do the possible benefits of living at high altitude at 7,500 feet for 50 years, how long does that last?
Meaning like if like if you leave high altitude, like how long does that? Yeah, that's a good question. I don't think we have. This is the challenge with epidemiologic data. So we don't have specific mortality type data to say what happens if you live here for 50 years and then suddenly you move to the coast because you want to sit on the beach. I don't know that I can answer that question. I mean, I think that obviously the things that we're talking about where your body has adapted will adapt to a higher oxygen, a higher oxygen environment over time. So I think that those types of changes will take place. And so, the challenge is that some of this may be lifestyle and other factors that are really impacting morbidity and mortality, and so those types of things would not necessarily change.
Okay. So you mentioned a lot about visitors coming here. Do you have any information regarding medical insurance for visitors?
That's a good question. I'm not well, the short answer is I'm not. That's not my area of expertise. So I don't know if they mean like specifically visitors who are like who have insurance within the United States. Generally speaking, everyone's insurance is a little bit different as to what the coverage would be in an outer network type situation. For visitors who are coming from abroad, I would imagine there are products that are sold. I know that there are products that are bought when people from the U.S. travel abroad, and so I would imagine that there are products, but I don't want to hazard a guess.
Okay. So you've mentioned that some of these issues can happen at high altitude. In general, is one solution that is helpful is to move to a lower elevation if some of these start occurring?
I think that's not really what I'm recommending. I think that we were kind of trying to talk about some of the physiologic changes that your body can have. I think on an individual basis, there could be certain diseases that, a frank discussion with your doctors as to whether if they thought that your condition would be better and that your risk of mortality would be improved if you were to move somewhere, so, I think that could be a discussion. Generally speaking, I think that we take care of lots of cardiovascular patients, obviously, and no, we're not, we're not recommending frequently that people move to lower altitude, but there probably are certain very specific subsets of people who that could be a consideration. But I'm not aware of a lot of people who frequently make those types of life decisions. I mean, again, unless, I think if your life is unbearable at this, at this altitude because of low oxygen and consequences of that, then I think that's a reasonable discussion to have with your doctors.
Kind of a segue to that is it better to live at high altitude, or is there a difference if you're coming in every weekend just to high altitude? Can you speak to that a little bit?
I guess the question, it depends on the, so I'm not sure if I don't know if I understand if it's like I'm living in sea level and then flying in for the weekend, or if I'm living in Boulder and going up to Summit County for the weekend. I'm not really sure.
Either one, the change in altitude.
I mean, I think that there are, my guess is that your body wouldn't fully acclimate if you were to be living at sea level and coming up for the weekend. I think that you would not have as much, of these compensatory mechanisms, because I think the majority of your time would be spent down at the lower elevation. With regards to, if you lived in Boulder and then you were going up to the mountains on the weekend, it kind of depends on where you go. I mean, I think that, generally speaking, I think that would be, obviously it would put some stress on the system and the body would adapt. But I think that again, as long as you're not living at 14,000 feet, I think it would be a reasonable thing. And
okay.
Yeah.
Could you be a bit more specific about the medications, aside from beta blockers, that become problematic as you go up in altitude, please?
Yeah, well, I mean, I think that if we talk about the renin-angiotensin aldosterone system, so that's a big class of medication. So, the medications that people are frequently on are ACE inhibitors, angiotensin receptor blockers, and then the aldosterone medications, things like the potassium sparing diuretics, like spironolactone. Those types of medications, again, may be they may be affected by higher altitude, and they may be less effective. And so, again, if you're finding that your blood pressure is poorly controlled at those types of altitudes, I think that discussing the specifics of an individual's case with their prescribing providers would be beneficial.
Okay. Will the use of oxygen at altitude ameliorate some of the problems you noted?
I think that with regards to, I think that there can be benefits with regards to, low oxygen levels and, the lung issues with regards to low oxygen levels. Clearly oxygen supplementation can be helpful for certain people. Again, that would have to be a discussion with your providers, because oxygen is a prescribed substance, and so that would require coming up with a plan with your doctor about that.
Okay. You talked a little bit about altitude sickness and about how water oftentimes helps with that. But if you're short of breath and experiencing altitude sickness, would something like Boost, which is a protein-based, would that help more quickly than just plain water?
And I'm not, I don't, that may be a little bit confusing. I mean, I think that in general, I was saying that, keeping good hydration at a higher altitude, especially, we do have a dry climate. And I wasn't specifically saying that water was a treatment for altitude sickness. So, things like Boost, I'm not aware that would be specifically better than water. Clearly, on an individual basis, things like Boost may be very beneficial for nutritional supplementation, but I wouldn't think of that as a treatment for altitude sickness. I think that the challenge with altitude sickness is that with decreased appetite, and nausea and vomiting, people can get very dehydrated. And so I think that finding ways to avoid getting severely dehydrated, which can worsen the situation, I think is the real, the key point there.
Okay. We're going to squeeze in a couple more questions and then
Cool.
wrap it up. Want to let our audience know we've done the best to get to as many as we can. There's a couple we have not been able to. Let me get to a couple here. Can altitude cause inverted T waves?
That's a good question. I'm not aware of any data to say that altitude specifically causes inverted T waves. I think that, we do see that, again, people can have more ischemia at higher elevation. So, and clearly sometimes inverted T waves can be a sign of ischemia. And even in healthy individuals, patients can have some decreased blood flow to their heart muscle that can be evident. So, I mean, I think it's possible, but I just don't know I don't know the specific data, so I don't want to. Yes.
Okay. Moving to Boulder from sea level, how long does acclimation take?
I think everyone's a little bit different, so I think it can take several months, and some people, I think just again anecdotally, some people it takes many months. So I don't know that I can say a specific number per se, but I think that knowing your body and kind of taking your time and adjusting to the environment is probably the safest way to deal with that.
Okay. Well, we've come to the end of our time.